Home videos are probably one of the most important tools, if not the most important, we have for diagnosis of epilepsy.
Hello fellow humans. Today's Epilepsy Spots Insights episode is one with a bonus. I am talking to two inspiring people, Alexis Arzimanoglou from Lyon, France, who is a paediatric and adult neurologist and lead of the European Reference Network for EpiCARE, and Rosaria Vavassoria from Italy, who is the founder of AHC Europe, mum to a son with the rare genetic epilepsy AHC, and an EpiCARE European Patient Advisory Group volunteer. Both Alexis and Rosaria work together with others to improve the lives of the people affected by a real shockingly rare epilepsy. AHC stands for Alternative Hemiplegia of Childhood. And this in itself is pretty incredible because many of the symptoms of this genetic disease are kind of as yet pretty unexplainable. If this sounds as interesting to you as it does to me, then stay tuned. And if you haven't already, and if you want to, subscribe to the channel and hit the bell for notifications. Together, let us improve outreach, epilepsy awareness, understanding, and funding for research. Thanks so much, both of you, for joining us today. Alexis, could you tell us a bit about yourself, first of all, please?
Of course, Torie. Thank you for inviting me. I am Professor Alexis Arzimanoglou. I am a child neurologist and a neurologist, working mainly in Lyon, France, where I am heading the Pediatric Clinical Epileptology and Neurophysiology Department. And I also have the opportunity to collaborate with my friends in Barcelona, Spain, in coordinating their research group. But I would say with time, not to say with age, my main job became to mainly work for the development of the European Reference Network for Rare and Complex Epilepsies, EpiCARE, which is one of the 24 European networks for different diseases developed by the European Commission it was launched in 2017, so it's quite young. There's a lot of work.
But a lot has happened in that time, which we will speak about in a moment. Rosaria, could you tell us about yourself, please?
Yes, thank you, Torie. I am Rosaria Vavassori, living in Italy. I am the mom to Alberto, who is affected by AHC. He is 20 years old now, and since we had the correct diagnosis of AHC for him when he was 4 years old, I basically worked as a patient advocate and as a collaborator and supporter of the work of the researchers studying this rare and complex epilepsy. I created the Italian Association for AHC, starting to work with a few doctors that at those times knew the disease and had some patients with AHC. And then we started to create further contacts and collaboration also abroad in Europe, and that's why I met Alexis and his group and the French Association. And then we managed to create this international collaboration for the research on AHC, and now I am the data manager for the International Consortium for Research on AHC and all the ATP1A3 rare diseases. I am managing this international platform for the data collection and sharing for the multi-center studies of this consortium. Alexis is the scientific coordinator, together with Professor Mohamed Mikati in the US.
And Alexis, could you tell us a bit about AHC, please? Because for many listeners, I would say probably the majority, they have no idea what AHC is.
AHC, for alternating hemiplegia of childhood, in fact, is a very rare neurological disorder that in most of the cases, if not all, appears in early childhood, but of course can go up to adulthood. And what mainly characterizes it, at least at some part of its expression, is what the name is called, alternating hemiplegia, which means that the patient can be paralyzed of one member or one side, or one day, and the other day it could be the opposite, while the first member that was paralyzed, the arm or the leg or the whole side, is totally back to normal, which for us was and is very, very difficult to explain, to understand the mechanism. Of course, at that time when it was first described, all investigations on vascular problems were done, but everything was negative. These children mainly have a number of normal basic investigations that we usually do. And then they progressively develop epileptic seizures, but they also develop abnormalities of movement that can be a stiffness of an arm, or what we call a dystonic posture, and so on, which in fact also represents a huge difficulty in terms of treatment choices, because we already have very few drugs. We don't have a treatment for the disease itself, but on top of it, even for the symptoms, sometimes it's very difficult to know, is it A or is it B? And of course, you cannot use the same treatment for A and B without knowing what it is. And there, the input from the parents, the home videos, the video EEG monitoring help a lot to make a diagnosis.
Yeah, as is often the case for more regular epilepsies, if you like. It's amazing how I think the past few years, with the development of technology on our phones, has really contributed to receiving more accurate diagnosis, I think.
Home videos are probably one of the most important tools, if not the most important, we have for diagnosis of epilepsy. I mean, we should not forget that epileptic seizures are paroxysmal. You don't have them all the time. They appear. So until the appearance of the iPhones, or the phones, the smartphones, not to make this.
Are you pimping out the iPhones here? Are you an
I
Apple
have one,
ambassador?
but, it's not necessarily an iPhone. From the moment it's a smartphone, it's enough. We doctors started seeing what we were treating, because before we just had a description, and the description, and alternating hemiplegia is one of the best examples, is very, very difficult, even when the parents are very precise in their description. So yes, it revolutionized the whole care of epilepsy, the fact that we could see the symptom we were trying to treat.
I also think it's really important, and you've already towards this, is that the epilepsy is just part of this rare disorder. Just like I was actually speaking to another clinician recently about what is an epilepsy, and to me, what takes priority is not actually control over the seizures. And the more people I speak to, the more people that seem to agree with me that it's a whole lot more than only the seizures. What's your reaction to that, Rosaria? What do you think? What's it like for you, your husband and your son?
AHC, exactly as Alexis was saying, is a combination of so many diseases and so many comorbidities, associated disorders. It is not only seizures, but many other types of paroxysmal episodes. You can have sudden attacks of dystonia. My son, for example, suddenly he gets completely paralyzed, or very stiff and painful, and he can have plegic attacks, floppy paralysis. He can start to have abnormal high movements, or breathing difficulties. And it is completely unpredictable. You don't know when he can have any kind of these episodes or a seizure. It's very difficult living with this continuous possibility. In addition to this, all these possible types of episodes, you also have movement difficulties, movement problems, a poor balance, so you have always to to be careful when they walk. They can have intellective difficulties, problems in speech.
It's very interesting what you're saying, because so many of these comorbidities, if you like, or what is part of this disease, I see in people with other types of epilepsies too. And we had a private discussion, I think last week or something, about how there are so many similarities between the different epilepsies, but they have different genetic causes. And so therefore treatments need to often be different as well. Would you agree with that, Alexis?
Particularly for epileptic seizures. And as I say, when we talk about rare epilepsies, a rare epilepsy before becoming a rare epilepsy is just an epilepsy. It means that they have exactly the same clinical symptoms, epileptic seizures. And then some of them will end up being a rare disease. Some others will be very common. And this separation between the two needs to be done as early as possible. Then when we come to the diseases such as alternating hemiplegia and so on, you are absolutely right. Each of the symptoms taken separately can be a symptom of another disease. What makes the difference is the combination of them together in one patient. That is what defines a disease, not the symptom. The symptom is one of them. But then you need to put the puzzle together and put the eye movements together with the paralysis, together with the dystonia, together with the seizures, and say, well, this could be an alternating hemiplegia. And still, you are not absolutely sure, because it is a matter of experience how many of these symptoms you will recognize as linked or not to the disease.
Do you know, what you're saying reminds me a bit sometimes of how it can be difficult initially upon observation for many people just to distinguish between, say, epileptic seizures and non-epileptic seizures. Things can look so very similar. I know that, you'd obviously, I imagine, know, but on the outside, things look the same.
It happens to me also to mix them up or have a lot of difficulty. That is why we use video electroencephalography to record the episode. That is why we say we need to see several episodes, because you see, epileptic seizures are very different between each other, but for the same patient, they have the same expression. And it is the fact that you have the same expression that makes you suspect it is an epilepsy and not something else. Let alone that, by definition, an epileptic seizure is what? At least when you have a movement involved. It is a normal movement that you could do anyhow, but during an epileptic seizure, it is exaggerated and it is repeated all the time. When I move my arm, this is a normal movement, but when my arm moves without being controlled and shaking, it is still a movement, but it is an epileptic seizure.
Yeah, and then we have the even more complex thing sometimes is trying to recognize when somebody has a focal seizure, and when there is no movement, then that is even harder, right?
Well, or even there can be one. They can be just chewing or just so.
But interestingly, I had a focal when I was in the pub last night, not drinking, just so everyone knows, and I just said to my partner, just so you know, I had a bit of an aurifocal going on, and he's like, oh gosh, you're right. But I was talking to him. He would not have known if I hadn't have told him. And it really makes me feel for many people with intellectual disability with things like AHC often, because how do you communicate, for instance, these types of seizures or these reoccurring feelings, to your carers and to your neurologist? And I think that can be a bit of a stumbling block.
Definitely, you're absolutely right. That is one of the main difficulties, both in diagnosing and even later on, when you have the diagnosis, and let us say you have a symptomatic treatment, something that could reduce the number of episodes. If you are wrong on what is the nature of the episode, what do? You change the drug, you increase it, but maybe you are targeting the wrong movement. And that is why it is extremely complicated and it needs a lot of experience. But again, saying this, because we are here with parents, I think it is extremely important to have these children with all rare diseases followed in reference centers, but they also need to have the local physician pediatrician or adult neurologist or child neurologist, even if he or she is not fully experienced in the disease, they need to have a follow-up of proximity. Because by definition, you have a number of other things that pop up in the everyday life of the parents, of the brothers and sisters of a handicapped child, and the expert center can't do everything. I mean, they need the collaboration with a local colleague who knows the child. And the role of the reference center is to help this colleague know better the disease of the one child he is following. But the two are needed. You can't have only one.
And then there's the link between, you know, a lot of children with these psychiatric comorbidities as well, right?
Of course.
And so needing help with that. And again, for the mums and the dads, Rosaria, you know, I think often the mums and dads for kids with lots of rare epilepsies or non-rare epilepsies, but in this case, of course, AHC, there needs to be the support for mum and dad, even if you're only thinking about the child or adult, because, you know, despite any intellectual disability, I would say most of the time we can actually tell how our mum and dad are feeling, you know, and that has an impact on the health of the child or the person that you're caring for. From what you've told me before, Rosaria, like being involved with groups and with EpiCARE as an advocate regarding AHCs, actually being quite encouraging for you as a person, right? You've met other people who kind of get where you're coming from and you're able to influence progression for this rare epilepsy?
Exactly. Collaborate with other, the collaboration with other patient advocates for other rare disease helps us all to identify the common needs that we have, so many comorbidities, in addition to so many symptoms, in addition to epilepsy, to seizures, the need of a multidisciplinary team following our children, not only for neurology, the main expert in neurology, but also other experts taking care of all the other associated problems. The need of a psychological support for our children and for us parents too is absolutely very important. And also the importance of having a local center as close as possible to us that can provide a continuous care to our children, but always with the counseling and the help, the support of the reference center that can provide exactly the knowledge, the counseling to address all the more complex symptoms and provide support to the local physician that is supporting us and our children. This is important, and it's also important to create also this transversal, horizontal layer in the network for sharing, sharing between us, patients and parents and families, and especially sharing ideas, sharing data between the different reference centers in the network.
Brilliant. Yeah, to hopefully improve people's lives in the future. I think that's what it's all about, isn't it? To collate this data and input. And sometimes I think about things from the perspective of the clinician, the epileptologist, or even the GP, for instance. And you can't, as you were saying earlier, Alexis, you can't know everything, right? And so I think sometimes it can be rather overwhelming when you get this family approaching you with a diagnosis and you have nothing, you don't know anything about it at all. And you think, what do I do with this? But that's where the network comes in really handy, I think, because if there's a channel that they know that they can access a professional down, which they can through EpiCARE, that kind of ticks the box for the professional as well as the family, would you say?
I can even say worse. I think that the good doctors are the ones who ask their colleagues. those that don't ask are not good. It is impossible. And it becomes more and more difficult because we are entering an era or a period where we look for more precise diagnosis. The patients need more precise information, and it is their right. We are trying to discover targeted therapies for a specific disease as a whole and not only as a symptom, and this can only be done at an international level, and since we are in Europe, at the European level. Those, either doctors or countries that think that the treatments will be found, I don't know, in a city or in a country, they are totally out of scope. It will never happen that way. It is by chance, yes, for one, but the rest is a matter of collaboration, of exchange of ideas, of meeting people, networking and discussing, and not only via Zoom, there are also needs to meet them and discuss. And this is how it will go on. And it takes time. Rosaria knows it very well. It took 15 years to find the gene, and it took another 10, and we start discussing treatments. The same applies to many other diseases, because this is how it is. It is not against us or against the parents. It is extreme. The mechanisms are very complicated. We learn every day. We are probably wrong sometimes, but then we need to also reestablish, and I think that this is what networks as EpiCARE help to do, to reestablish a confidence between the doctors and the patients. This is extremely important. Patients are not doctors and doctors are not patients, and you cannot select what you like from medicine. You need to be confident in something, and this is the only way to work together. And the confidence needs to be mutual. I mean, if Rosaria comes to my clinic and gives me half of the symptoms just to testify I'm intelligent, I will never make the diagnosis.
But so I'd say some of the best clinicians, though, I've ever met have been the most modest. The same goes for scientists, because like that, I've spoken about this before, but the Dunning-Kruger effect, the more you know, the more you learn, the more you realize you don't know. And that is so true in medicine. But having been to some of these EpiCARE events myself, you know, you can feel the warm energy, and people just they're not there for any money at all. It's there to improve the lives of the families affected. And I say families because it really is the family that is affected by the rare epilepsies rather than the sole individual with the diagnosis. If anyone would like to get in touch with you guys, how would they do that? Would it be through the EpiCARE website or what?
EpiCARE is a network of hospitals. So directly the patients have to go through a hospital in their region or in their country or in a neighbor country for a case to be discussed. And the reason is obvious. I mean, individually, if we don't have part of the data collected after having examined the patient correctly, the network, which is virtual, cannot give a correct advice. The risk of mistake is huge. So we need to have a contact with a colleague that summarizes the data and comes up. So that is one. Now, as for patients with alternating hemiplegia, because this is what we are talking about, there is no doubt that today, with the support and the work done by Rosaria and many others, there are patient associations, both in the US and in Europe and in other countries. And the contribution of the patients is very important. It is difficult. It is difficult because they already have a huge amount of work because they have a sick child. They don't have that much free time, but it is important to contribute. And when I say to contribute, it takes time to give your time to the network, not to your child. And these are not exactly the same things. I mean, your child, you have a different job to do. And Rosaria, when she collects the data for the registry, yes, she's working also for her child, but she's working for another, 2,000 children collecting the data. And this is important.
Getting involved in this way lets you know that you are not alone. Well, you still feel awfully alone, but to know that there are other people who can that have some idea of how you're affected means the world.
Yes, absolutely. When I got the diagnosis of AHC for my son, my first idea was to look for other families, for other families that were having the same, living the same experience with AHC. And exactly by meeting other families that we started to understand the importance of working together to create a group, a community, and not only of families, but a global community together, involving, collaborating, supporting the work of the researchers, of creating contacts and networks between all the clinical centers, and so growing our network and our strength, both as a community but also individually as person. Exactly, know this feeling of not being alone fighting this disease.
For people today, for people now, if they want to get in touch with a patient advocacy group, I know the EpiCARE is one. It's epi-care.eu. If you go to the EpiCARE patient representative page, there is that, which will put, there's a lovely picture of you there, Rosaria. But also for clinicians who are interested in this, there's also a page, if you go under for patients, find an EpiCARE health professional. And then a clinician page exactly just for clinicians. Well, anyone can look at it, but you know what I mean. So it's about getting everyone together. Well, it's been lovely chatting to you both. I thank you so much, because this is a really sensitive topic, but it's a really cool topic as well, because we've got lots of hope for the next 10 years because of guys like you.
Thank you, Torie, again. Thank you, Rosaria, and thanks for all the work you both do at different orientations.
Many thanks to you, Torie. Thank you, Alexis.